on sport and exercise therapy at the University of Wolverhampton. My name's Keith Burnett, and I'm one of the lecturers on the sport and exercise therapy course. So I'm going to be running through today the session overview, looking at the course and a little bit about the underpinnings of the course and how we enrich the course ready for employment and the bigger, wider picture rather than just its course itself. So the course is a Bachelor of Science degree in sport and exercise therapy. Now, we have an array of different programs within our department, and our course will then look specifically at the injury rehabilitation, the screening and assessment of injuries, and specifically looking at these 5 pillars based on a professional association with the Society of Sports Therapists, who is our professional body. So the course itself has been accredited by the lead of the profession of the society. So the Society of Sports Therapists go off 5 pillars of education, what develops us to become a sport and exercise therapist. So the 5 pillars we would look at throughout the 3 years of the course creates your competency in order to be a professional sports therapist. So we look at these 5 pillars and develop your understanding, knowledge, and application based on these 5. So we look at the prevention, which is actually stopping an injury occur in the first place. So we call prehabilitation. You'll be looking at the fitness, the testing, and all the different applications that are needed in order to stop injuries occurring in the first place. So our whole profession does not look at just treating injuries and rehabilitating them, but also educating in order to stop these things occurring. So we also come into the second pillar, which is our recognition and evaluation. So it's also about looking at how we recognize things that occur, how different specific patterns of training, patterns of performance may cause risk. So we look at evaluating how we can make a difference in terms of our athletic population. So the sports therapist role generally is the musculoskeletal therapist that works in with the athletic population and sports population, but we also work in a clinical environment, which I'll have a discussion later on. So we are known as the injury therapist working in sport, but also we can work in a clinical environment, as we can see in the picture there. We then come into the second or the third role, should I say, when we look at our management and treatment. So we go through the different understanding of how we manage an injury through the different processes, whether that's immediately coming onto the field of play when the injuries occurred, or whether a couple of days later they come into your treatment room, and you go through the process of understanding what is the correct pattern. Our course is then identified in terms of following on this process until we get into the rehabilitation stage, where we'd then probably be working in a gym, a strength and conditioning environment, or our application of working at the home gym if this is a person that's working from home. So we then go into the final aspect where we say, well, actually, we look into the education and professional practice of this by looking at where we can help the athlete, help the team that we're working for, make things occur for themselves rather than be very, very reliant upon ourselves. So we talk about professional practice in terms of what we can do, what we can't do, and the different dimensions around what sports therapy is. So the whole department is accredited by the Sport and Exercise or BASES, and literally it underpins all the sports provision that we create. Now, the question we look at is why Wolverhampton? So Wolverhampton University has had a big investment in terms of its facilities. We can see now the way that we deliver was in a technological enriched environment. So that's one of our education rooms where they're surrounded by interactive screens. They're all got computers. So all the learners will basically be, as they're within their practical environment, able to access different apps, different sources of information, and we enrich that environment in that learning process. We've also got the strength and conditioning facilities that we deliver within, so you're going to get a top of the range facility. It's what we've done here is the investment we've put in marries what the top levels of industry expect. So you're going to be taught in the environment that you're going to be working in. So when we look into this environment, this is an applied environment that we work. So all of our staff members are actually applied therapists and currently work within the field. And I'll explain that shortly of who the staff profiles are or who the people are that's going to be teaching you. So we're innovative in terms of the way that we actually deliver. Because we work in high performance sports and clinical environments itself, we basically bring that innovation in and looking at different opportunities to do so to give you currency of what the industry expects. So we set the graduate up to either work into any level of sport, whether that's professional sport, community sport, clinical environment, or into education, if that's the sort of process you want. So the things that we've got is innovation to basically look at thinking outside the box to make the learning environment a very, very effective one, but very much an enriched, enjoyable environment. So the campus itself has has a lot of different opportunities for this to take place. So when we talk about applied, we talk about that our staff members are literally in field, and you can see myself there. I work with England Rugby League universities, and that's one of our sessions. Katie will discuss shortly. She runs a clinic and works with different sports. So we're physically teaching your knowledge based on what we do on a daily basis. So it's not just out of textbooks or out of journal articles, even though that's enriched to what we do it from professional practice and our evidence base of our own experience. And then we've got to look in terms of our courses. It's sport and exercise therapy, but it's actually underpinned with sport and exercise science principles. So we'll be taking you into the laboratory where we're doing physiological assessments to learn about things like cardiac screening for athletes and physiological profiles for rehabilitation, so we can understand what the different benchmark and markers are for in order to get this working. So we'll be in the top of the range state-of-the-art equipment on a regular basis within our practical settings and our theoretical settings. So let's have a look at who the people are that teach your course. So myself, it's a two-person team at the minute. We've got Katie Davis, who's the course leader, and myself, Keith Burnett. So just a little bit of view over with Katie. So Katie runs her own clinic. So she has on a daily basis, basically working with clients from all different domains, whether that's from an athletic population or a general population, with a background in ice hockey. So she worked on ice rinks alongside with the teams, and you'll get a different understanding from the different people that's been taught in terms of their experience, many years of experience. Now, myself, like I've just said, my name's Keith Burnett. I'm from a rugby background generally, so I work with England Rugby League in the university department, and I'm the sports therapist there. So I work in an applied setting of high performance, but I've also got a background of working with the British Army. So I'm within strength and conditioning. So you can see me there in my domain where I'm working pitch side, where I would be dealing with injuries as they occur, or I'm doing rehabilitation or prevention training. So we're there doing our strength and conditioning. And then at the bottom, for your successes, this is myself going to Twickenham, working with the Leicestershire Rugby Union county team. We were the champions there. So my background is in an applied sports setting where I would then work in that sort of domain. So when we talk about the modules later on, is you'll see that we specifically teach modules based on our specialisms rather than a general sort of, we'll just teach this because that's what we're available to do. So my background is the sort of trauma and conditioning factor, whereas Katie does more of the clinical setting, and it gives us a different variance of the different people that's teaching. So let's just have a look at the course structure itself then, because the course is built up in 3 different years, and it's level 4, level 5, level 6, and I'll explain as we're going through. We work in a block system here where we will deliver block 1 has its own specific information, block 2 and block 3 and block 4. But one thing I want us to look at in terms of the modules that they're doing, our modules are underpinned with external qualifications. So our block 1 module introduces you to university, and it introduces you to higher education, gets you used to the step up into university and the environment that you're going to be in. So it's not a big jump. You support it all the way through, but that prepares you specifically of what you need to do to become a university student. We then look at the fundamentals of anatomy and physiology in an applied setting. So there's a lot of movement science, a lot of underpinning and knowledge, because we need to know about the injuries before we even go into this. So we need to understand the structure of the system before we can actually start identifying how injuries occur. And alongside, you look at sports and exercise massage. So you get an applied opportunity and applied practice all the way from the start. Then, as it's just flashed up a second ago, we've got our module called training and conditioning. And now what this module does is runs alongside a professional qualification where we give you a fitness qualification so you can go and work in industry based on that opportunity. So you'll not only complete the module, but you'll also have alongside that professional qualifications that can enrich and also help you for employment as you're working alongside the course. So the idea then we go into our block 4 gives you another 2 modules where we're then learning about the fundamentals of injury, and then we're actually going to be applying this. And lastly, we've then, alongside our management trauma, you also obtain a sports first aid qualification that you can then again go out and start utilizing towards obtaining your support. Now in level 5, level 6, so level 5 is our second year. We start off with our second year from the start with a industry experience placement. So what we get is from the minute you start your second year of the course and you've passed the first year through, you get the opportunity to then start learning by doing. So you're actually going out and then obtaining industry experience along the whole duration of your year, whilst you're then supported across all the other modules. So when we're looking at your employability again, is you're not only coming out with a qualification, but you're coming out with confidence and a competence and experience of knowing what the industry is about. So rather than just going to university, you're going to go out there and actually have a good understanding of your next step of where you want to go. So the module runs alongside the other modules where we're then going to look at rehabilitation, how to rehabilitate athletes effectively. We're then going to look at more examination of the body so we can actually assess someone properly. And then we underpin this and prepare you for your final year with our research methods. And it allows you with our scientific underpinning to start exploring things of your interest. So we would then guide you in order to then start looking into independent study of your own research area. So moving on into our third year then, what you do within our third year is we'll have a clinical placement. So you then go out there and you'll be working within a clinical environment. And you'll do this for 250 hours across the year. So this is a placement that runs alongside your modules where you can then choose whether you want to be working in a sports environment, a clinic environment, but it's an area to then sort of refine your skills and refine your experience to then go off into industry. And by the time you're finished. So we then come into our more advanced level 6 modules, and you'll come across the professional project where we get you to start exploring as a graduate preparation to see the area of interest. So my area of interest is neck injuries, and I started that on my degree, whereas I started looking at neck injuries in rugby, and then I started going a bit further and further and further and specialize in that area, which started off in my professional project. We'll then have a look in terms of the difference between other opportunities. Our course is 3 years long. However, we also do a sandwich year course where if you wanted to, at the end of your year 2, you can then leave the university for a year and go work in industry. So we'd look at setting you up to work in industry, to go out to sports teams, to education environments, to clinical environments. And what that will then do is give you a little bit more support in terms of your knowledge, your application, but also your understanding of where you want to move into for professional practice. So some students do have a gap between their second year, their third year. After that year, they'll then come back and then complete their degree. So their degree will then be 4 years instead of 3. But then you've got the opportunity to have worked within the field of expertise. So one thing we do with our course is basically discuss understanding of where you sit within a performance domain. So the difference between the course of physiotherapy, for instance, and sports therapy or sports rehabilitation therapy is we're looking at the performance athlete, whereas physiotherapy is generally looking at the general public and working with a wider domain of different factors of the body. We work specifically with musculoskeletal issues, which is our muscles and our skeleton. So our sports injuries, as we look there. But one thing we've got to understand is where we sit within our domain of a team base. So in a support team, we'll be looking at your roles, who you work with, and what your attributes actually head towards. So within my role, I'm a sports and exercise therapist. In order to be able to increase athletic performance, as we can see from this diagram, is I've got to work with a number of other people in that teamwork environment. So it's not just my role to keep that athlete on the pitch or being able to keep that person playing effectively. I've got to work alongside all of these different practitioners. And what the course allows, because of its sport and exercise science underpinning, we then get an insight into all of these different factors of these courses. Some people will then leave our course on graduation and go into further study, and they may choose another one of the topics to then create themselves to be what they call multidisciplinary. They can then apply themselves into different settings. So I've got a background in sport and exercise science as well as sport and exercise therapy. So I can apply myself into a number of those roles within that multidisciplinary team. And some sports clubs will employ you to do many jobs, and some sports clubs will allow you to do a specific job. So when we're looking at this, we prepare you to have a taster of these different roles, so then you understand what other people do or what you can then input into that role as well as a sport and exercise therapist. Now, the opportunities we have in our universities as a whole, as well as our department, is these are industry recognized um, teams that we work alongside, and we're building and building as we've basically developed the course to have more opportunities for the students to go out and work. So we'll look at local community-based events. We'll be looking at general and national events, marathons, cycling events, where we get the opportunity for students to go out there and apply their skills under a supported network. So working with the different environment, the British Judo is based on our campus, so there's opportunities to work around these performance environments, and you'll see that we sort of work alongside these effectively. We work alongside our books, which is our British University sports teams, where you'll be applying your skill set in pitch side first aid, and you'll be working alongside the team. So your role would be to support a team as it's playing on their home games. You'll then have the away game to support, and then we'll be running things like massage clinics within the university, where an athlete may come and ask for a pre-event application. Now, this links directly again into your employment, because our university, our graduates have got high impact in terms of their effectiveness at where they go after they've graduated. So their employment is 96% into work after they graduate from our courses. So that's the strength of the impact. Now, where do they go into? As a sports therapist, there's many different factors you can actually look at. So yourself, once you finish, you can either go into sports therapy in elite sport or community sport, wherever the sort of factor you're going into. So your premiership teams, your division 1 teams in rugby, football, netball, all these different sports. You can also go into health promotion, because the underpinning of what you're doing basically talks about your knowledge and understanding of how to become healthy, how to become more effectively suited for roles or general public and population. I apologize. So then exercise referral specialist. So when somebody's got issues, you may be referred to by a general practitioner or a GP, where you'll be working in a clinic environment and a fitness center, and maybe someone comes out and they're sent to you with issues where you're then going to rectify by training with them. Now that sports therapy is actually being seen in the NHS as well as private clinics, so we're accepted as rehabilitation specialists, where you may be working with somebody that's post-operative, so they've gone in for an operation, or they've had a problem with their system, their circulatory system, which is their blood system or their heart. You'll then help to support them to rehabilitate them back to life again. Or then finally, you may even want to go into teaching. So there's an opportunity to go into teaching, because that's the pathway again that myself and Katie have gone down. So we're applied sports therapists, where Katie will work into the private clinic, I work into the elite sport, but we both lecture. So we both look at that application for the both factors. But like we said, is because this course is a Society of Sports Therapists course, at the end of this, you will be classed as a graduate sports therapist and a member of that professional body, which is highly regarded in the industry. So you'll see a lot of opportunities coming across based on that status that you've got there. So when we're looking in terms of our course overview, just to reiterate where we are, is the course itself is built up with practicing teaching staff. So we've just identified there that we're not just lecturing staff, we're actually on a daily basis working with these different sports. And we also work with different environments. So for instance, even though rugby is my background, I also work with tennis, I've worked with athletic populations. And what we will do across our course is literally teach you how to do all of the skill set of a sports therapist, but with applied settings in different environments. So you're not just blinkered towards a specific sport. So I work within different, I work within football, and say tennis, a different factor on there, but we'll show you how you can actually apply your skill set to those environments. So with what the sort of background of ourselves and the way we teach, you're looking at applied teaching and learning and assessing how you will actually do this in industry. So we teach this with relevance by using technological enriched environments. So we bring in different apps and with different applications where you can then see how this is actually impactful in your field. But we actually teach you to how you would be doing your work on a daily basis as a sport and exercise therapist. The way that you assess in this is we assess exactly through competency, because it's a professional qualification. We then assess your knowledge base by doing, rather than just the basic writing of something. We'll be showing you how you do it, and then you'll be assessed that way as you would be doing in a field. Because what happens when you're a sport and exercise therapist and you go off into industry, most of the time the interviews to go into industry has a practical element to it. So you have to show your competency based on there, not just your knowledge of by talking to someone. You have to be able to do it. So the way we look at this of our course, you get 12 hours per week on the course, and this is made up of, so that's per module, you'll have 12 hours per week depending on what you're doing. And the way that we deliver this is we'll deliver this with informative gathering of a lecture. We then have seminars where we can then disseminate the information and discuss the information effectively, and then we put it into play. So we then apply every single week. Each module has 2.5 hours of practical application, because what we then do is say, well, you're learning, you're doing it, then you're reviewing it, and you go away then with this practical application. We record sessions so you can then go back to it and then watch them again. The space that we work in as I say, is a state in our teaching space. Each of our treatment booths have a camera, have a TV, and it literally allows everything to be recorded. All of our rehabilitation equipment, again, is modern day, top of the range that we use. And we again give you the opportunity to work with your hands, but also with the technology. So you've got that opportunity to work across the dimensions of application. So again, we've got different opportunities in terms of our professional development that we underpin and enrich within your course. So not only will you come out with your degree, you'll also have other opportunities for experience, but also additional qualifications. So when it comes down for you to then go out into industry, not only like other universities have you got your qualification and your experience while you've been on the course, you've also got more enriched opportunities, and that will make you more applicable to the domain. So like I said about in the first year, if you've got your pitch side first aid qualification as well as your gym qualification, in your second year, maybe you could apply those into working in a gym or within a local sports team. So as we then start putting this in, the big focus on our course is employability. From the minute you walk in the door, we want to create the best environment for you as a sports therapy learner to become the best sports therapy graduate. And by the time you finish, you will walk straight ready, employable ready into a job of the caliber you're looking for. So while you're studying on our course, we have academic support from our tutors. You will have a personal tutor and academic coach. We go through teaching you literally about utilizing all of the skill set, but also how to research effectively, how to then being able to study independently. And we're creating you as a whole package ready to be able to go out into industry as we've identified. But then when we finish, we've also got the career support, and we look for opportunities for you to go with. We support you through those domains and literally support you as an alumni to go through and be a point of contact for you to go through from there. So just to reiterate in terms of this course, it's a 3-year Bachelor of Science Sport and Exercise Therapy course, where each year you're going to be doing different modules, and the modules will give you a different taste and application to become a different multidimensional sports therapist. You can work in different fields, becoming a graduate sports therapist. And again, these opportunities really are then being put in place for you to then apply your knowledge and application to the different environment. By the time you finish, you will be a confident and competent sports therapist from the University of Wolverhampton with a degree in sport therapy or sport and exercise therapy with other additional qualifications on top of that. And there may be options again for you to sort of specialize in different areas, but this course will allow you to go on to postgraduate study or into industry ready for the sort of choice you want to go into there. Okay, so that brings us to the close of this sort of presentation onto the application on there. What we'll do before we go into the question side, if you are interested in a little bit more information, looking at the study of sport at the university, there is a YouTube link that we can put into the chat for you to look in there. Looking at our sports courses as well gives you some more information around our department, also about where we're coming into our specific course. But another thing as well, what we want to think about with the course as well is a lot of students want to play sport, and there's a social element towards the university as well. So there's a link on there for you to understand that we can be playing sport alongside your studies. Again, generally Wednesday afternoon is where the students would go out and play sport. Now, if you have got any questions and it's not linked into ability to be able to chat it now, our course leader, Katie Davis, will be available to take in emails or any chats in terms of that aspect on there.